Welcome to the Medical Marijuana and Wellness webinar series. Today's topic will be pain management, something that's near and dear to a lot of people's hearts, including mine, and one of the main reasons why people use medical cannabis. I have a few housekeeping issues I want to bring up. First of all, we're here to really help you, and we're here to help answer your questions about medical cannabis, especially with respect to pain management. So please feel free to ask questions. That's what we're here for. And if you look down at your little menus down here, right over here, you'll see a little Q&A. It looks like two little bubbles. Please feel free to ask your questions. We'll be monitoring that and answering your questions either during or after the webinar. And again, we're here to really help you get your questions answered. There is a chat button right over here. What you'll see with the chat button is you can put in the chat, but we mainly monitor the Q&A button. So to guarantee your question gets addressed and answered, please put it in the Q&A button. Today's webinar is going to be something that we know is near and dear to a lot of people's hearts. And so the information has been thoroughly researched, and hopefully we can be able to provide some answers to you if you have some questions. I'm honored today to bring someone to you who's been involved in cannabis for a while. I've been doing webinars with him, or seminars, I should say, as far back as about 3 years ago. Randy, we did a webinar in Northport. But I'd like to introduce you to Randy Jelks. He's with Trulieve. And Randy, tell us a little bit about yourself and what you're planning to do.
Sure. My name is, as Marc stated, my name is Randy Jelks. I am with Trulieve. I'm one of the community educators. So I actually go out into the community and educate them on the benefits and uses of cannabis. I also go to many different events around the state of Florida and educate other communities besides my own. But I actually used to work inside of retail, and then came out to educate the physicians, but definitely happy to be here tonight.
Yeah, and you've been involved with a number of patients, not only that, patients and doctors, and a lot of it addressing pain management. Is that correct?
Yes, sir. That's one of the #1 issues.
Oh, great. Well, listen, I think what we want to do is we don't want to necessarily make this all slideware, but we do have some slides that will help people get some information and also help bring up some questions. So I'm going to share my screen if you don't mind. And let's go here. And I do want to mention that this webinar is part of a webinar series. The fall medical marijuana and wellness webinar series we're currently in the middle of it. If you look over here, we're in the pain management version. Next week, we're doing Delta 8, the week after topicals, anxiety and stress, and ketamine. So we've been addressing a number of topics that you can actually watch in the future by going to Medical Marijuana Aware, which is where you went to register for this webinar. And if you missed any of these other topics that you're interested in, like seniors, terpenes, arthritis dosing, on that same website, if you go to the follow-up tab, you'll be able to access the webinars, the videos, the presentations, and the resources that are from those particular webinars. And I will mention that tonight's webinar will be streamed on Facebook. And what you'll get after this webinar is an email from us that'll give you a link to the video, which will be coming off of YouTube. You get a link to what we call a flip PDF. So it's a version of the presentation in a PDF format. You'll also get the resources, and you'll be getting information about Trulieve, their discounts, and a lot of programs, as well as about some of the programs that we talk about as we go along. So stay tuned. You don't necessarily have to take copious notes because you will be getting a copy of the presentation in flipbook format, but please feel free to do that if you like. And again, we're here to answer your questions. So Randy, let's dive into this. What I like to do is first of all start about talking about what is pain, because I know pain has a lot of definitions for a lot of people. And obviously it's an unpleasant sensation that a lot of people have. And it can come from a number of different areas. It can come from tissue damage. It also can be combined. It can come from different sensations. Pain comes from physical problems. It also comes from sensations, emotions, trauma, anxiety, fear. There's a lot of things that contribute to the pain pile besides just physical injury that's out there. What's interesting is the medical field defines pain to be changes in your muscle activity, your heart rate, your blood pressure, and even in your sweating. So pain is something that we all have experienced, and it's something that's there. It's interesting that what's about the pain, it also triggers what they call the flight, fight, or freeze syndrome. In other words, with pain, people either run, fight, or freeze. And so it's something that is actually the human nature is to use this to be able to protect or to defend ourselves, depending on a particular condition and our mental state at the time that particular occurrence occurs. But pain is something that's real. I think we've all experienced it. What types of pain do we have? Well, there's really like two different types of pain. There's acute pain, and acute pain is one of the most common patient complaints that I hear about, and a lot of doctors hear about. By the way, I'm a practitioner. It's something that happens. It's something that it due to an occurrence, and something that will go away in a couple of months or a couple of weeks, depending on the situation. Chronic pain is also something that we deal with. It's something that's misdiagnosed quite a bit, and also been mistreated for a long time. Let me be very specific about what we're talking about. Acute pain typically comes from an injury. You have some sort of an injury, you have some sort of an illness, you get acute pain. Typically, it doesn't last for more than a few months. Hopefully, under some doctor's cares, it goes away, and it's something that's not necessarily reoccurring. Chronic pain, what they found about chronic pain is it's occurring regularly. Typically, it's been occurring over a long period of time, and it just builds up in your body, and it lasts for more than 3 months. What we found in many cases, chronic pain is something where people have 2 or more particular conditions. They may have, for example, inflammation in their knee, and they may have some pain in their shoulders. And when you put 2 or 3 different conditions together, it contributes to that chronic pain. And a lot of times chronic pain also can come from the stress and anxiety that we have in our lives, which over the last 1.5 years or 2 years, all of us have had a lot of fun with this COVID thing. And I'm sure there's a lot of stress and anxiety in your world. I know it certainly has been in mine, that's out there. Doctors have had difficulty diagnosing chronic pain. In fact, 4 years ago, I had a number of doctors in a conference that I was in tell me there wasn't such thing as chronic pain. I basically told them that I have chronic pain. It is real. And just because you can't diagnose it, because they're looking, pharma looks for one problem, one pill. That's what they're looking for. If there's 2 problems, it's very difficult for them to find it. If there's 3 problems, it's even worse. And for example, in my case, I have herniated discs in my neck from an auto accident. I'm blessed with 7 of them. And then I also had a knee operation, a knee replacement. And when you put 2 of those together, it causes a pain condition in your body from inflammation and from swelling. But all I'm trying to point out is that if you have those occurrences, you have pain, and you're not alone. If you look at chronic pain, it's one of the top conditions cited for long-term disability here in the United States. And again, it was interesting that almost 4 or 5 years ago, the medical profession didn't recognize it, and they are recognizing it today of something that's really out there. So what about cannabis and chronic pain? Well, there's been a lot of studies that's going on about medical cannabis, chronic pain. I do have to point out that because cannabis is a Schedule I drug here in the United States, there's very little research that's been done here in the United States on chronic pain, on cannabis in general, especially with respect to pain in general. Most of the research that we're going to present to you today that's been out there is coming from overseas. It's coming from Israel, it's coming from Europe, it's coming from England, Germany, Spain, South Africa, and a number of different places. But it has been studied rather extensively outside of the United States. I'm talking about cannabis and pain. But what's interesting about it is one of the studies that came up reported that 62% of the patients with chronic pain that were in the study found that the use of medical cannabis helped with their pain. Now, 62% is a big number. If you're in the pharma business, that's considered to be well above what you're looking for with respect to the studies you want to do. It's interesting that when you use medical cannabis with pain, it not only has a low risk of addiction. In other words, you can't get addicted from medical cannabis, but more importantly, a lot of the pharma drugs options for pain, which is opioid based, have not overdoses that are fatal. And what's interesting is nobody's ever died from using medical cannabis. So it's a safe way of addressing pain, and it's something that has been proven to be very effective as well as very safe in this particular route of administration. And there's no evidence linking it. The other part about it is there's no evidence linking cannabis to any kidney failure. You take a look at the number of drugs that are out there, the Tylenols, the Advils, all those different things, Adderalls, those kinds of things. They all will cause either kidney or they'll cause some sort of a liver damage to your body, taking more than 2 or 3 weeks. And people who take it for 2 or 3 months have been able to have those problems. You don't have that problem with cannabis that you've seen. Randy, you've had some experience with cannabis and chronic pain. Anything you've seen from a study standpoint or some testimonials that you've seen?
From a point of my own personal point, actually broke my foot probably about a year ago, and I still suffer from somewhat chronic pain, but I utilize a product called RSO and a few other different routes in order to um, help out with these certain situations. But um, yeah, um, going back up just a tad bit, having cannabis has no record of fatal overdoses. That beats water, that beats peanuts also, but also at the same time, the LD factor in general is little to none. Nobody has ever died. So, um,
Yeah, I think you were referencing a study that was done that showed how safe cannabis is, where nobody's died from it. More people die every year from eating peanuts than they do from using cannabis, which is kind of interesting.
it's sad, correct?
Really sad, really sad that that's out there. So what is cannabis effective at what it is addressed? Well, we know there's studies, and these are studies that have been done on chronic pain, whether it's been ALS, whether it's been Parkinson's, epilepsy, PTS, anxiety. There's a lot of noted studies that are out there, and we're going to reference a lot of them in the follow-up material that we give you. But there's also, what's interesting is physically a lot of different states allow medical cannabis or allow pain management and chronic pain to be one of the conditions that let you qualify for a medical cannabis card, Florida being one of them that's out here. Cannabis has been proven to be safe. As I mentioned again, there's no overdoses from this, and it's a great option for people that are really tired of a lot of options where the opioids are just getting worse. They're worried about addiction. It's not really working because after a while your body becomes tolerant to the opioids, and it's really helped people manage themselves, not only to manage their pain, but also get off the opioids that's out there. So we've seen that happen a number of times that are out there. How do we know that? Well, there's a couple of studies that are there. One that was done in the United States, which is what they call an anecdotal study, which means that University of California, which is at Davis, went out and did a study. And what they did was they went to people who already had neuropathic pain and that were using cannabis. And what they looked at is they looked at what they were using and was it effective. And what they found out that was cannabis was the most effective methods to be able to manage neuropathic pain in the particular study they were at. Now, what's interesting is McGill University, which is in Canada, which is in Montreal, they found that they did a more complex study, and they found out that it relieves not only pain, but also helps with sleep quality, anxiety, and a number of different things that are out there. And you say, well, how long are those studies? How old are those studies? One of the studies we pulled up was in 2019, where 80% of the participants basically said it was extremely helpful with their pain management. It usually takes a year or two for studies to come out. So if a study is done in the year 2000, it basically is published in usually about 2022. So this study has been one that just got put out. And it's something that we have medical evidence. We have research that basically says pain, that this works. It's there. And also you'll find as a follow-up, there's a number of different pain management. I've been referencing a lot of the studies that are done. Here's all the different studies that are out there. I'm not going to go through each one of them, but they're all studies that we'll provide in our reference material. And if you want to read up on them, you can. But it's been studied for a long time, and it's been studied very effectively. And it's been proven that cannabis does help a lot with pain. Pain and inflammation, anxiety and stress are the main reasons why people turn to using medical cannabis. And I just want people to feel comfortable. I know if you're new to cannabis, you're saying, well, gee, is it studied? Do we know if it works? Has it been looked at? It's not only been looked at here in the United States from studies like in Davis, but also around the world. And it's probably one of the most studied conditions that are out there today. What I'd like to do is I'd like to provide, many of you are familiar with the gentleman Sanjay Gupta, and I did a major mistake. I forgot to click on the video part when I came on to share. So I'm going to unshare my screen, and I'm going to reshare my screen for a second to get the video to play correctly. This is an operator error on my part. There we go. Oh, I got it. So this is a little clip from Sanjay Gupta's CNN Lead 4 program that you might find very interesting on pain management. So.
THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe, in part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas. It's more absorbent than cotton and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
What we're trying to point out here is that what's interesting when you look at this video is that you have a situation where the decision to
THC.
make cannabis illegal was a political decision. It wasn't a decision based on medical science. The science proved that it did in fact work. At the time, the decision to prohibit medical cannabis, but that doesn't mean that it isn't working, and it doesn't mean that people haven't continued to use it from that time. One of the questions that comes up is how does it address pain? I know we're getting some questions on people who have different conditions, and one of the ways of answering the questions is to understand how cannabis works and how it addresses pain that's out there. And there's an endocannabinoid system each mammal has an endocannabinoid system. We have that system. It was something that was really found in 1940s initially, and then it really wasn't made popular. It wasn't brought to the forefront until the 90s and the 80s and the 90s when Dr. Raphael Mechoulam was studying cannabis, and the effects of cannabis. And that's when he discovered the endocannabinoid system, which is something that we use, which our body uses to be able to basically regulate itself. Randy, this is something you might want to help me a little bit with. In our bodies, we have these, what Raphael Mechoulam showed us was we have CB1 receptors and we have CB2 receptors. These are receptors that are in our body, and they actually, is how your body helps to communicate with itself, and it helps to be able to, it helps it manage itself. And what's interesting is cannabis works like a lock and key, with those receptors to be able to address issues like pain, like sleep, like memory, like appetite, like inflammation, and autoimmune systems. It's interesting that what it does, it works with the CB1 and CB2 receptors. And so your body, what your body is basically doing is your body basically has CB1 receptors that are in the brain and the central nervous system. They have CB2 receptors that are fundamentally found in your organs and in your immune system. And by that way, your body's able to understand that you have a particular problem. And then once you have that problem, it's able to produce cannabinoids to be able to address it. Very specifically, you as a person have endocannabinoids in your body, and you actually produce endocannabinoids. When your nervous system sees a problem, it produces the endocannabinoids. Those are sent out to that part of your body and addresses that particular problem that's out there. Now, photoendocannabinoids, which are the buds, the tinctures, the cannabis that for example, the Trulieve makes, those actually augment and supplement the endocannabinoids that your system needs to be able to address the different conditions that your body is identifying as a particular problem that's there. I do want to point out there are synthetic cannabinoids that have been produced. Now, these are lab-produced cannabinoids. Mirinol is one of them, which is THC only. It doesn't really have as much of a medical effect. It has a very specific medical effect. It's more like a pharma drug than it is like a holistic drug.
But it won't give you that full entourage effect, though.
Yeah, it's exactly it. It doesn't give you the full entourage effect. And we'll talk about what that is in just a second. But what I'm trying to point out is that I have kind of a philosophy, and that is that it's very hard in a lab to be able to synthesize an apple, a pear, a banana And it's very hard for them to do that also with cannabis. They can isolate parts of it. They can isolate different portions of it, like THC only from Marinol, but it really doesn't give you the full medicinal properties that cannabis does. It's only, again, rifle shooting and things that are out there. And you might say, why do I need to be able to augment a lot of this? Because, for example, I'm a senior citizen. My body, although I have endocannabinoids, my body needs additional endocannabinoids because it's not producing the endocannabinoids like it did when I was younger to be able to address a lot of the conditions for pain and inflammation that I've had before. So this is something that you might want to take a look at. I'm not a fan, by the way, of synthetic cannabinoids, and I think the only way that you should use it is under very, very strict control and monitoring by a doctor. Outside of that, I would I'd steer clear of again, the synthetic cannabinoids that are out there. So how does cannabis work? What's interesting is your body produces endocannabinoids. Your brain will notice there's a problem, and that'll trigger the production of endocannabinoids. And also what's interesting is if you have photoendocannabinoids, all of that gets stored in the fatty acids that are in your body. So you have these fatty acids, they in essence work like batteries to be able to store the cannabis the CB1, again, the endocannabinoids that we need to address your situation. Your brain, your nervous systems, through your nervous system recognizes there's a problem. Your body doesn't need a doctor to tell you you have a problem. It recognizes it has a problem. It tells the brain that you have that problem, and the brain converts those fatty acids down into what they call long chain fatty acids. And once it does that, the next thing it does is it then sends those endocannabinoids to that portion of your body, distributes it through your bloodstream to be able to help you be able to address that particular situation. And this is how cannabis works. Cannabis doesn't go directly into the CB1 and CB2 receptors. It goes directly into your fatty acids. And then again, your body controls the production and the distribution of the endocannabinoids throughout your whole body. This explains really two things. Number one, why hasn't anybody died from cannabis? Primarily because it's your own body producing its own medicine. This isn't a foreign substance coming into your body that's attacking the various parts of your body. It's you're working in sync, in harmony with your body to help your body put itself in homeostasis. The other is this explains something called the entourage effect. And what's the entourage effect? What it is it's where you take cannabis for one reason. For example, I may take it because I have inflammation in my knee from a knee operation, but it's also helping with the herniated discs in my neck. So it's addressing two or more situations. My mother, for example, is taking medical cannabis to address her cancer. She took 4 years ago. She's been on medical cannabis treatment for cancer. And what she found out after she started taking it was it helped her with her glaucoma. And we didn't target it for glaucoma, but it helped her with that. So there's been a number of cases for this, and this is the reason why the entourage effects works. Randy, do you want to chat a little bit about the entourage effect for a second?
Sure. So the entourage effect is what you get from whole plant flower, or how do I explain this? The entourage effect is all the cannabinoids and terpenes, THC, CBD combined into one, and bringing your body back to homeostasis in a way. So certain products you will get the entourage effect from. Other products are geared towards certain cannabinoids or terpenes.
Right.
So
sure. Well, let's just dive into that for a minute, because that's an interesting subject. Why don't you talk a little bit about, Randy, tell us a little bit about CBD and THC, which are two of the main components in medical cannabis.
Sure. So you have CBD, which we all know. CBD is cannabidiol. It's a non-psychoactive cannabis component, also found in hemp. When it's found in hemp, it's found with less than 3% THC within there, which we're going to get into as well. Also, you have THC, which is tetrahydrocannabinol, which is the psychoactive cannabis component we all know as giving you that euphoric feeling. But it's not all about these two cannabinoids, but these are the main ones that have been studied, as well as will give you that entourage effect with terpenes added to that.
Yeah, now you can find both of these in both, let me back up a little bit. I'm getting ahead of ourselves here. You can find both of these in both hemp and marijuana, right?
Correct. You can.
Yeah. You can. Tell us the difference between them.
So I like to think of marijuana as you stated in the top right up there, different dog breeds, or I like to think of it as like little brother and little sister in a way. So marijuana is the big brother, it does the big hard work, different jobs, and hemp is the little sister in a way. She creates the fibers. She also creates medicine, oils, different things of that nature as well. But um, same family, but different types of plants, just have as you have up in the top right. So in the same way that a fluffy corgi, a lackey or a greyhound, and a stocky bulldog are all dogs despite different features, both hemp and marijuana are variants of the cannabis plant.
It's kind of
So
like roses. You see different kinds of roses, but they're all still roses. What's
correct.
interesting is hemp tends to be more of a stock, more of a hardier. It has it's more like a tree. It's more like it's taller. It has thicker leaves. That's why it's used for building materials. It's been used
Industrial.
a lot for it used biofuels. Which is how it got into trouble because Ford was starting to build cars based on biofuel using hemp and that as a material. And the petrol companies didn't really like that. But also, it does have medicinal properties in that it does produce CBD and THC. Marijuana on the other side is very much like a plant. It's more like a bush, hence why they call it weed. And so you'll find it to be more of a bushier plant. Just to give you an idea, in order to produce a small bottle of hemp of tincture oil, it takes 8 hemp plants to be able to do that, or it takes about a half a bush or half a marijuana plant to be able to produce that same quantity. And the reason I point that out is because a high quality hemp product will be actually more expensive than a high quality marijuana
product, correct.
because of the raw material that's out there. And there's this huge perception that hemp is cheaper. And the answer is because the hemp that's been out there has been provided at a very low cost. And usually when you look at what's in the bottle versus what it states on the bottle, there isn't anywhere near the amount of medicine that's in there that you think that you're buying. It's just because the bottle size is the same. It's not what's inside is very, very different. Not to say that hemp isn't important and hemp doesn't help. It helps quite a bit. And it has a lot of great properties. It's just that there's differences, and there's something that people should take a look at. Hemp obviously is legal in all 48 states. Whether you can sell it over the counter or not is really left up to the states. It's much like alcohol. They all have their different rules with respect to the state regulations. Marijuana is also the same way, and 33 states have now made it legal, and 11 states have actually are actually made it legal recreationally as well. So there is a difference between them, and we'll talk a little bit about that a little bit, but there are different versions of products that can help with pain, and both hemp and marijuana products basically do that. You know, Randy, when I got into business 9 years ago, all I heard about was sativa and indica. I know we hear a lot less of it now today, but tell me a little bit about sativa and indica.
So originally, sativa and indica were believed. Sativa would get you up, motivated, and going. It's going to be one of the more elongated plants. It's not going to be as bushy as an indica plant. But with the indica plant, it's going to be a smaller, shorter bush, and basically it's going to. We used to hear this term indica in the couch, but we're steering away from that and getting into cannabinoids and terpenes now, because
Right.
we're getting back to the entourage effect because of our endocannabinoid system to get back to homeostasis. So
What you guys have done, like people at Trulieve, you guys have done as you're studying this and as you're learning more about it, you're actually mixing and matching products. You're providing what they call ratioed products,
yes, sir,
and you're putting strains together into what they call hybrids. So I
Correct.
know that today, when you go into a dispensary like Trulieve, you'll hear a lot about hybrids itself, and that's really a combination of an indica and a sativa put together to address a particular medical condition that's in your body. And so hybrids are actually good for you. They're actually something that has been something they've discovered, and it's a huge step forward in providing medical cannabis to a lot of patients.
Definitely is. And I just want to touch one point on that. At Trulieve, we actually do our strains as a traffic light. So our sativas are green, our hybrids are yellow, and our indicas are red. So if
Yeah.
you see a red top on there, just know that you may be possibly falling asleep, but it may keep you up depending on your body. As Marc stated in the beginning, everybody's body's different. Everybody has a different endocannabinoid system. So
Well, it has to do a lot to do with also the terpenes. What we've also
correct.
found that there are terpenes. You know, what are terpenes? terpenes are part of a plant that help protect it. It protects it from having other animals eat it, and helps basically the plant to be able to preserve itself. And so those are the things that grow on. You see it on every plant that's out there. Essential oils basically are the harvesting of terpenes to put them into those essential oils.
That wonderful aroma.
Yeah, the aroma that's out there. So when you smell, somebody says, I hear the smell of this, it's really the terpenes that you're smelling, not necessarily the cannabinoids that you're smelling when you get the aroma that's out there. But, you know, what I tend to do is what's interesting about cannabis is the cannabis is more of a holistic way of addressing medicine. It's not take 2 pills and call me in the morning. There's not a set formula for this. It really has to do with what your metabolism accepts or doesn't accept. And I tend to look at it like people look at alcohol. You know, there are people I know that have 1 drink and they're done for the night. There are other people that they take a whole bottle and they're only just warming up for the night. It really depends on your body and your metabolism. And with cannabis, it's the same way. Some people are very sensitive to THC. They're also very sensitive sometimes to CBD. So we have a method called go low and go slow, meaning start with a little bit of it and then go up to be able to find your level. How sensitive are you to THC? Are you sensitive or not to CBD? And so you go low and go slow until you feel that euphoric effect that comes into play, and then you kind of back down a little bit from there. And that's how you find your dosing that you need to have. And your dosing will be very different from other people. I know I use cannabis for my pain in my back and my neck. My wife uses it for a lot of the anxiety and stress that she has in her life, and her dosing is very different than mine. She's a 12-to-1, meaning 12 CBD to 1 THC type of person, maybe even 20-to-1. I'm more in the category of 4-to-1 because of the amount of pain that I have from the 7 herniated discs that are out there. So it really depends on the different people that are there. And you've probably experienced a lot of that, haven't you, Randy, in your life, seen that?
Oh, definitely. Like you said, it depends on the person's body overall. So say, for instance, we'll get into edibles, but say, for instance, you took an edible on an empty stomach or something like that. You're going to have a totally different reaction from Lou has been doing it every single day of his life. He took an edible. It doesn't have any effect on him. So like we said, everybody's body is different, and dosing is very, very, very important. I would recommend that you all keep a journal of what works for you and what does not work for you, when it worked for you, how long it worked for you. So those are very important things that as a patient, we all should be writing down and having as reference to look back on.
I mean, one of the questions we get a lot of is, what dosage should I take? And really, that really depends on you. It depends on your body. Like I say, it's like the alcohol syndrome. You know, it depends on what your body accepts and what your body likes. And your body will tell you what you really want. And we're going to talk more about this later. But I do want to dive in a little bit to, before we get deep dive into dosing. This is what they call a CBD wheel. And this is produced about 3 or 4 years ago. I haven't found a new one yet, but it shows that cannabis has over 450 different medical properties. And these are the different major components. And by the way, there are over 450 medical properties. There's over 180 different cannabinoids that they've been able to identify so far. They haven't been able to study all of those, but they do know that they exist. And each of them has its own medical property that's out there. There's the CBDs and the THCs. And obviously, the CBDs have very little, if any, euphoric effect. The THCs actually do have a euphoric effect, meaning that you can get high from using them. I do want to point out, you may get high, but you're not going to die, okay? And I also want to point out that one of the nice parts about cannabis is that CBD offsets the high from THC. If you put THC and CBD together, like that's why you hear about ratio products, 20-to-1, 8-to-1, 1-to-8, whatever's out there. The CBD helps to be able to mitigate the high that you get from THC. So that what's happening is that if you are doing some dosing and you are trying to figure out where your level is, if you do begin to get a little high and you're uncomfortable with it, just take an equal amount, a portion of pure CBD, and it'll bring you down from that high, probably within 5 to 10 minutes, if not 20 minutes. That's out there.
Correct. And just remember the model: start low and go slow. You can always add to what you're doing, but you can't take away. You can take away, but you can always add. So it's always going to be there. You have it in general. So
now, Randy, where were you when I was learning how to drink when I was a teenager?
I don't know.
Going low and going slow wasn't one of the things we did, man. We
Oh,
counted at it.
understood. Hey, that was the smart way of doing things. But
Yeah, well, we're getting a little bit smarter as we go along, but it's the same. It's something that we pay attention to, and it's something that will, in fact, help you. And your body will tell you what works and what doesn't work. It'll tell you what your ratios are. A lot of people say, I need to talk to a doctor. Well, the doctor is just going to look at you and say, tell me what happened. And that's really what's important. Listen to your body. Your body will be able to help address it. But you can see in the different components that are here, there's the Delta 8s, which are here, which is good for pain relief. But also, if you look over here, you see there's CBGA, which also helps with pain relief. You'll also look over here that you take a look at THCA. It also helps with pain relief and helps to suppress muscle spasms. By being able to put in cannabis, we have a thing called the whole plant effect. By being able to put CBD, and THC together, this 1 and 1 becomes 3, and it works a lot better working together than working by themselves. And in fact, I'll make a comment and been proven out by science. CBD by itself helps with inflammation, but it doesn't necessarily help with pain. It does a little bit with pain, but a lot of the pain that it's helping to relieve is because you relieve the inflammation, and when you relieve the inflammation, you relieve the pain. You need a little bit of THC in that formula to really be able to address the pain that you're feeling right now.
correct.
Right, Randy?
Correct. Very correct.
It's out there. And there's kind of a popular boutique drug. In fact, next week we have a webinar just on Delta 8. So if you're interested in Delta 8, please join us next week. We'll do a deep dive into this particular subject. But Delta 8 is something, it's what I call a boutique drug. People hearing a lot about it. They think they've heard that it helps a lot with pain. And there are a couple of different versions of it. There's the hemp-based version and there's the marijuana-based version. What's interesting is that Delta 8 does in fact help with pain relief, but Delta 8 has to be used with CBD and THC to be effective. There's a perception that you can use Delta 8 by itself and it's going to address your pain. The answer is it isn't. And in fact, it has to be mixed with something to be able to be effective that's out there. What I like about the marijuana-based CBDs, and especially Trulieve, is you've been able to take this and build hybrid products like building CBD and Delta 8 products.
A 1-to-1-to-1, yes.
The 1-to-1-to-1, yeah, that's down here. You guys call it Laughing Buddha.
Laughing Buddha, yes, sir. Yes, sir.
Yeah.
It used to be Diablo, but we swapped to Laughing Buddha, and that is I love. Like I said, I'm a patient myself, and that's one of my favorite products because it's very mild, as the statement above says. Delta 8 has little to no euphoria, so it's very clear thinking. And if I'm having, say, for instance, pain in my foot, my knee, or my back, I'm very tall. It will kick that pain right out, and it's immediate. We're going to go over that, but it's definitely like with vaping. I normally vape, so it's going to be immediate, and it lasts for the amount of time that I need to last for. So.
Right. So I think you can get it. There's a lot of the hemp-based products that you buy over the counter, do have Delta 8 in it. The only thing I want to caution people about, and again, I'm not against hemp. I just think that one of the things we need to make sure that there's a quality standard. There's a certificate of authenticity that comes with that hemp product, because there's a lot of stuff that gets pushed over the counter there's no regulating factors for it today. Where when you go to the marijuana, you go to the dispensaries like Trulieve, you guys have to test each product 3 times before you can put it on the shelf. Is that correct?
That is 100% correct. You will actually get test results with your product as well. So each one of our products comes with a QR code. So you actually see QR codes over here on my screen. So that's just information. But like I said, on the top of, say, for instance, our flower, it has a QR code, and you're able to scan that and then go directly to our website, type the number in, and be able to pull up the test results to see what's in your cannabis in order to see what is working for you. So it shows you the cannabinoids, the terpenes, the levels of terpenes and cannabinoids, but we also test for heavy metals and other things of that nature as well. So it just doesn't stop just at cannabinoids or terpenes. So
right. And that's one of the things that are out there. Hemp-based Delta 8 is effective. It has a very low amount of THC in it, 0.3%. It probably isn't as effective as medical cannabis versions, but it is available over the counter. So, I mean, there's kind of a pros and cons to a lot of things that are out there. So I just want to mention, I do want to mention Delta 8 because that always gets brought up as a subject, and it is an effective pain management. I know that, again, I use the one down here, you call it 1 to 1 to 1. I'm absolutely, I carry one of those pins around with me all the time because, again, I had an artificial knee put in 2.5 years ago, and 5 years ago I had 7 herniated discs in my neck and 2 in my back. And so I tend to I have pain management as part of my motif today, but I've also got to manage my pain and stay very clear-headed and be able to function, to be able to do webinars like this, and to be able to do my job on a daily basis.
So this has completely changed your life, Marc.
It definitely changed my life. It gave me my life back. I'll tell you that. That's what it's all about, which is what we really want to do with this webinar. If we can just have one person watch this webinar and get their life back, then we think we've been successful. Yes. Again, I'm going to ask you if you have any questions, please bring them forward. We're here to answer those questions, and we'd be more than happy to dive down. There's no question there's no bad questions. There's always good questions that are out there. Let's dive into something else called terpenes. We talked about that a little bit earlier. Terpenes are something that are found in cannabis. In fact, there's over 200 different terpenes in cannabis, but kind of the big 6 are the ones that are listed here. Tell me a little bit about the terpenes, Randy.
So we have a number of terpenes. These are the most common terpenes, as Marc stated. So we have linolene, pinene, linalool, myrcene, caryophyllene or B-caryophyllene, and then we have a eucalyptol. Touching upon just certain terpenes here, linalool, for instance, we find that from lavenders. You see the lavender photo, so that's gonna sedate you a little bit, as well as give you some stress reduction. But also, a number of these terpenes are anti-inflammatory as well. But besides that, these terpenes will give you your aroma, as well as some of the effects, as we were stating before, as the entourage effect. So it's about that whole plant medicine. Another one of my favorite terpenes is going to be myrcene. Myrcene is found within mangoes and is also sedative, but at the same time, you can actually eat a mango maybe an hour or so before you medicate, and you'll have a more pleasant experience. So, yep.
Cannabis likes certain other other terpenes as well as fats. So that's kind of a very, very good thing.
Yep, it works well within the ecosystem. So yeah.
Now, one of the terpenes that I like to look for is eucalyptol. And the reason for that is because it not only has a lot of anti-pain, a lot of anti-inflammation characteristics, but it also is good for blood pressure, which is something, as we get to be senior citizens, it's something we need to pay attention to. That's also out there. So it's very, very important. Pinene is an important one as well, right?
Correct. So this is the most common terpene in natural nature. A lot of people, I like to use flower a lot. I'm a flower person. So whenever you smell flower, if you smell the earthy smell, that's pinene in there, or the pine, like tree type smell, it's going to be pinene. But it's a good pain reliever and anxiety, of course, again, an anti-inflammatory, as well as a bronchial dilator. I'm sorry about that. But it also helps open your airways and then improves your short-term memory. But like I said, pinene is the most common terpene within nature, and these aren't only in, like Marc said, cannabis, but essential oils, a number of different things. So you can actually find terpenes, I believe, online by themselves, if I'm not mistaken. They still sell them like that, but
there are companies that do sell terpenes, and again, there's only about 4 of them that really sell high quality terpenes, so be very, very careful. Yep. I do want to point out one thing about pinene. Pinene is great and it's very common, but it also brings back short-term memory. And the reason I say you be careful is because if you're suffering from PTS, it's something you may want to stay away from. It's not necessarily something that's going to complement or help your particular condition. So a lot of people suffering from PTS, whether that's been through an accident, traumatic experience, or whatever, they tend to stay away from the pinene terpene in the medications that they use. So, we had a question earlier. I think Judith, you asked the question: are we going to talk about strains? The answer is yes. And do you want to go through this, Randy? You want to take the strains?
Sure. So there are many different strains. These are a few of the common strains. I know ACDC is a very popular strain. It's going to be a CBD dominant strain. We have it, I believe we have it in 16-1, but Harley Quinn is going to be another one. It's going to be a high CBD strain. So it's not going to get you so euphoric, but it's going to relieve the inflammation and pain within your body, depending on the individual and how much you utilize. But we also have one, could you go to the next page really quick?
Actually, before you do that, I'm going to mention there's a one called Blackberry Kush, if you can find that one. And that's really good if you have, like, for example, when I had my knee operation, where you get throbbing pain, it's very THC dominant. So just be aware. But if you really have that level of pain, it's something that's very, very effective. And it's something that, again, you can ask. One of the questions that's coming up is, do the dispensaries sell terpenes as a tincture? The answer is most dispensaries do not. But what they do is they sell terpenes as part of the cannabis products that are out there. So you can ask about the terpene profile of the product that you're buying. And in fact, you can go in fact, Randy, you can go into one of your bud tenders and you can actually ask them for some products that have these particular strains or these particular terpenes in it, right?
Correct. You definitely can. So if like you're a immersing individual like I am, or a pining individual, you can ask the patient consultant there at the dispensary, please show me a few strains that have B-caryophyllene or myrcene within there, and they'll be able to happily show you certain ones, because like we said, that's what it comes down to. It's not about the THC levels within the plant, but it's about the terpenes and cannabinoids.
Right.
We have a product at Trulieve called God's Gift, and it's actually a 1-to-1. So it's going to be actually, we're going to get to this, a ratio product, but it's a 1-to-1, which is another good balanced THC to CBD product. So it's kind of like CBD critical mass in a way, but it will give you that entourage effect as well as benefit throughout the day. But we also have the white blackberry headbang, as I stated, CBD critical mass, and then Master Kush. Each one of these has a different terpene profile. It's either THC dominant. Most of these are THC dominant strains, but you will see the comments on the right hand side depending on the strain and the name. So Kush, for instance, I like Kush. It relaxes me. That's because of the terpene profile, the cannabinoid profile, depending on the strain.
When I first started using medical cannabis, which was right after the auto accident, I went to a medical cannabis doctor. He gave me his recommendation. I then went into the dispensary. In fact, it was a Trulieve dispensary, and they obviously had access to my medical record. And they saw my condition. They saw the recommendation from the doctor, and we talked a little bit. And then they came back and they said, "Here's what we recommend." Now you take a look at my background. This is a dispensary. You walk in, there's a lot of products that are there. And when I first went to the dispensary, I was kind of shy about asking questions. So I took the product, tried it, and it worked. And it came back about 3 weeks later to get some more. But I was a little bolder, and I asked the great question of, how do you know what works for me? Like, out of all these products that are here, how do you know what was working for me? And the lady behind the counter said, "Look, it's very simple. I'm looking at your recommendation. I'm talking to you about what's going on, and I'm matching the terpene profile to the medical condition and to the relief that you want to get." And it dawned on me at that point in time, this is medicine. This is where they're taking a look at what terpenes, what cannabinoids can be used to help me with my particular condition.
Correct. And we will get onto it at a later date, or not later date, but in the slides as well. But we offer consultations at our dispensary as well. So if you have questions, as Marc did as well, you can actually ask for a consultation. Somebody can actually take you into one of our rooms and provide you that one-on-one feedback or any questions that you may have aside from the lobby.
One of the advantages of working with Trulieve and a number of the quality dispensaries that are out there is that they will provide you, consultation. And by the way, the consultation is free. And you mentioned going into a room, you can call Trulieve, you can set up a consultation, and they'll do that via the equivalent of a Zoom call or telemedicine call. and you can spend a half hour with these people. It doesn't cost you anything, and they'll address your situation, and they'll help you identify the products that'll help you with your particular condition.
Correct. Even if you're not a patient, you're able to have a virtual consultation or a consultation. Just either go to our website, but we'll have that. I'm pretty sure towards the in the slides somewhere in here.
Right. I know, Marilyn, you were asking a question. She was saying that she was using some liquid sativas. She's been around for a while. She used liquid sativas, and she'd like to have something that could pick up her mood, and she doesn't know what to try. My recommendation is get a consultation. Call Trulieve, set up a consultation. You don't have to go down there. They'll do a telemedicine type of thing. And I think you'll be able to get some good answers to that particular question. I know that I don't have a bevy of, it's not a complicated question, but it's one that you really want some personalized attention to be able to help you with that.
Correct, because we'll be able to go back into your profile to see what you purchased in the past and see what worked, what didn't work, and why it didn't work, and basically be able to have an in-depth conversation with you to figure out, okay, this might or will possibly, hopefully work. But at Trulieve, again, if it does not work for you, you have the ability to return it. So we have a 100% hassle-free return policy. So if it doesn't work for you, just let us know. No worries. Do not have to be ashamed or anything like that. Just let us know it doesn't work for you and you bring it back to us.
I think that's one of the advantages of Trulieve. If you got the product and it doesn't work for you, you can bring it back. Even if you've used half the bottle, you can bring it back and you'll replace it. And I think that's a phenomenal policy. I would compliment Trulieve for doing that. It means that you haven't bought a lot of product that's sitting on the shelf not being used. You have products that clearly can be used.
Correct. Now don't abuse that. Now I always tell people don't abuse that, but use it wisely.
Sure. So there are different ways of dosing. I know that when I got in the business, I was thinking, well, not everybody's going to sit on the front porch smoking a joint doing this. We've gone a long way from those days. There's a lot of different ways of using medical cannabis, from tinctures all the way down to concentrates. Randy, tell me a little bit about them.
Definitely. So there's sublingual drops, inhalation vapes, capsules, topicals. Going back to capsules, I was shocked when I first became a patient. I didn't even know there was capsules around. I come from an older time when, as Marc said, there was just flour. So when I heard about capsules, I was stoked. I'm like, there's really a 10 milligram capsule I can take at night if I'm having trouble sleeping, and take that capsule and it'll put me to sleep. And it actually worked for me. So, but we also have topical sprays, edibles, flour, and then concentrates. Those are all forms of cannabis. Each one of them are unique to its own self, but we all have these different products. Going from top to bottom, I would actually.
I'm gonna go down to here for a second, because this will tell you the onset effects and how long they last.
Nice. So yeah, actually I'll use this one. Yep. So going from actually top left to bottom right, tinctures would be like a good starting point for a newer patient, for me, in my mind. But that onset time would be 15 to 20 minutes, and that lasts from 4 to 6 hours. So if you're having pain, say for instance, Marc, you're having pain all day, I would say, Marc, grab a tincture, man. Have a tincture in the morning sometime that's going to last throughout the day. And then if you have an immediate pain, go straight to vaping.
Randy, I have to tell you, I have 7 herniated discs in my neck, and left untreated, if I don't use any medical cannabis, I'm in a pain level of a 7 or an 8 on a scale of 10. I've tried, when I had my accident, they gave me some opioids. I tried them. I literally couldn't sit on the couch. I mean, and not only did it have a lot of adverse effects, it really didn't address the pain. When I got into medical cannabis, I started using tincture drops. It helped quite a bit. Now, in my particular case, the tincture drops take about 20 to 25 minutes to work, where with other people, it could take longer, it could take shorter. But in my case, it lasts from 4 to 6 hours, depending on how much I take and what I'm taking. So when I wake up in the morning on my nightstand, I have a little bottle of tincture drops. I wake up, I take those drops. That's the first thing that I do. I know it's going to be about 20 or 25 minutes before they help me. So the next thing I do is I grab, and I know I'm skipping around on the slide, I grab a vape pen. And I take 1 or 2 hits out of a vape pen. That 1 to 1 to 1 we were talking about, I take a hit of that every morning. And literally within 2 minutes, the pain will go from a level of 7 or an 8 down to a level of 1.
And
And the first time that happened, I remember saying to my wife, "This is crazy." I mean, it's like somebody took a rag, wiped my back, and the pain went away. I mean, it was shocking. It was just absolutely shocking to me. And here I am, like literally 4.5 years later, almost 5 years later. And when I did it this morning, it's the same thing. You know, to me, it's just absolutely amazing how it helps me be able to really manage the pain and really get around the pain that's out there. And so you can mix and match these dosing forms. My case, if you take a look at tincture drops lasting 6 hours, if I take it in the morning when I wake up, let's say I wake up at 9 o'clock, I'll use that as a get out of bed time. 6 hours will take me typically to about middle of the afternoon, you know, type of thing. So I've really got to take something in the middle of the afternoon. Otherwise, I'm going to have pain an hour or two later. And then literally 6 hours later, I've got to take something else in order to be able to basically sleep through the night. So my regime is basically based on 6 or 8 hour regimes. I take, again, I use tincture drops as a primary, and then I augment it with inhalation. I'm a big fan of transdermal patches. I'll let you talk a little bit about that, as well as topicals. And also at night to sleep, I use edibles. So Randy, tell me about edibles.
So we have a number of edibles. We were actually the first company to come out with edibles at Trulieve, but we have nano edibles, we have gummies, we have chocolate chip cookies, brownies, regular gels, and then besides that, just a slew of edibles. Went out for a second, but yes, we have just a number of different edibles, but edibles are very different. So depending on, like I was saying before, if you take it on an empty stomach or if you take it with food, it will have different effects. But edibles most of the time will possibly last all day, depending on the person, depending on the patient, depending on what you've eaten throughout the day. But edibles is a good route for anyone that is shy about flower or doesn't want any other route of administration, but just kind of wants that long all day relief.
Yeah, edibles will last 8 to 10 hours. The other thing about edibles is they typically take up to about an hour to be able to work. So be very, very careful. There's famous stories about people who they're told to take like a half of a little bit of chocolate or a little piece of a brownie or a little piece of a cookie. You know, try a little bit, go low and go slow. And, you know, after about 15 minutes, it doesn't work. So they eat the whole brownie. And then what they do is they wake up an hour later and they've actually overdosed. From that overdose, that's meaning you've taken more than your body, you really want your body to affect, and you're getting that euphoric effect. So when you're using edibles, you use patience. You need to have patience. Let it take effect to be able to it's out there. I know I usually take a little piece of chocolate at night, about 2 hours before I go to bed. It helps me sleep through the whole night, which is great.
With edibles, you definitely have to time your dose and know what you're taking and know the feeling. If you don't feel anything, just keep waiting. Just have, like Marc said, have patience. On the right hand side, it says start low and go slow. So even though it says a 10 milligram piece, you can actually cut that 10 milligram piece into fourths and have a 2.5 milligram piece.
Right.
So you don't have to take the entire 10 milligram piece. Start low at a small dose just to see how you feel. You don't have to go full in. And then once you figure out your dose, your personal dose, go from there. And like I said, write it down as well. So you know exactly what works for you and when it worked for you.
Capsules have a longer lasting effect as well. With tinctures, when they go underneath your tongue, they go directly into your bloodstream. And which really helps. But when you have a capsule or an edible, it goes into your stomach, and the THC that's in it gets converted to hydroxy 11 THC, which is a different THC. It's a little bit stronger, lasts a little bit longer, but it's something that definitely helps with the pain as well.
Correct. Very correct.
Now, tell me about topicals.
So we have topicals at our dispensary. So we have a hybrid topical gel, and then we also have a CBD topical. So our hybrid is going to be 250 milligrams of THC. I'm sorry, 250 milligrams of THC within the container. You want to place the actual topical on your skin a little bit wet. So I would recommend using a surgical glove or some sort of glove so it doesn't absorb into your fingers versus where you want to actually apply it at. So that's going to be great for localized pain, and it's going to be almost immediate relief. So depending on the person, it's going to last up from 1 to 2 hours, but you can always add more. So again, even though it's a topical, start low, see if it works, see where it works for you on your skin, and then definitely go from there. But sometimes, since I'm so tall, I have neck pain, so I'll rub a topical on the back of my neck, or if I'm driving a lot, I have lower back pain from being tall. I'll rub a topical on there, and within 10 to not even 10 minutes, about 5 minutes, I'll feel the cooling. Maybe 2 minutes, I feel the cooling down, and basically I'm back doing whatever I was doing before, and it's just like I've forgotten about the pain. Which
We'll ask the question of any luck with topicals for pain. He hasn't had much success with them. I think that there's really two answers to that. The answer is yes, topicals are very effective. I use topicals for my neck for neck pain quite a bit. I practice a martial art. And obviously that puts pressure on my neck, on my herniated discs. And I use topicals before I work out and after I work out to be able to address that. And again, the topicals go to work almost immediately, and they'll last 1 to 2 hours that are there. So they're very, very effective. And you probably want to use a transdermal topical, which we'll talk about what that is later. I know that it's something that Trulieve has, but that's going to be more important than just a topical that you normally see. But topicals are extremely effective. It depends what kind you have. And again, you may want to look at what they call a transdermal topical versus the normal topical. Is that safe to say, Randy?
That's fine. That's fine. Yep. Definitely safe to say. Besides topicals, you have your smokable flower as well. And then smokable flower, everybody knows that, or as cannabis or as bud, but we call it flower in the medical cannabis realm. So this is also immediate, but you will get that pungent smell depending on how you utilize it. But we do also have vaporizers. So instead of burning the flower, you can actually place it in a vaporizer. And then, say for instance, we carry the PAX 3 as well as the Firefly 2. So and a few other ones. But you can actually put your flower in there versus burning it, and that will release the cannabinoids and terpenes out of that flower into your system without actually heating it up enough to have the carcinogens come out. Right. So a little different, safer alternative, but that's going to give you that immediate relief again.
And I don't want to overlook flowers from the standpoint of cooking. I know. Yeah. I've been turned on to the last quarter. I've been turned on to a lot of cannabis cooking, and I was told by somebody who's a cannabis cooking expert that about a third of all cannabis bought in flower form is used for cooking. Now they're in the cooking business, so I'd say they might be leaning, but there's quite a bit of flower that's used for cooking.
No, there definitely is. I actually have a magical, I won't say the company's name, but I actually have a machine by a company, and with my rec, I'll get a certain amount of flour. I actually have some coconut oil that I have mixed up, and yeah, it is phenomenal. So there's many different things that you can do with flour. Flour is very versatile. So with this flour, all of these other products have been created. So you can actually look at the left corner and then branch out from there. So all these products have been created from there. So just going over to concentrates really quick. If you are a new patient, I would kind of possibly say shy away from the concentrates until you kind of get into the swift of things, because they can be a little bit extreme in the beginning. But
once you know your dosing, then what you can do is you can use concentrates. And what concentrates do is concentrates help you cut down on the cost of being able to produce what you need. You're basically still vaping it typically, but you're able to actually focus in on the THC, the CBD, the terpenes that you want to be able to address that particular situation.
Correct.
Right.
Correct.
But you got to kind of get to the step one to know what you got to know what your dosing limits are. And once you do that, then you can use concentrates effectively. And a lot of people use concentrates for cost-effective measures.
Yep. And there's a slew of concentrates that we offer at Trulieve. I want to say it's about 10 different concentrates that we offer, but yeah, we do definitely offer them for the patient, ranging from shatter all the way up to live resin.
Right.
And those are totally different concentrates, which I will not get into, but there's a number of different products for patients to choose from.
And then sprays are very effective. The sprays actually work very, very quickly. I know a lot of sprays were developed for kids. When they had epileptic seizures, they were able to use the spray to be able to spray it in the kid's mouth and have it work almost immediately. But sprays are also effective if people don't like to, if you're worried about vaping, if you're a little shy about tinctures, vaping sprays are another very effective mechanism to use.
Definitely is. And we actually at Trulieve have a unique spray. So we have a spray called Cannatol, and it's actually for epilepsy and seizure patients. So it's going to spritz about actually, it's going to have 5 milligrams each spritz. So like I said, it's good for seizures and epileptic patients. It's geared towards them. But that's going to be a different type of spray. But I know you're talking about like a THC spray or something of that nature. But this will go up one of your nostrils, but there are instructions on the back of there. But like I said, it's good for epileptic patients and patients who have seizures.
Right, that are really effective.
Yeah.
So Randy, we've covered a lot about dosing, and but I think we talked a little bit about different dosing mechanisms. Let's talk about dosing itself, because like I said, I compare dosing to the same effects people have to either alcohol or caffeine. You know, some people are very sensitive to caffeine, some people are very sensitive to alcohol, some people are very sensitive to CBD and THC. I know that the people that you work with, Alex, is very sensitive to CBD, for example. You know, some people are sensitive to THC. He's sensitive to THC. He has the opposite effect, and that happens. It happens rarely, but it happens in some people, right?
It definitely does. And to mitigate that at times, like you said before, at that CBD in there, depending on which one you're sensitive to, of course, but you want to bring that down. But everybody's body is different. So dosing is very important. That's when we come back to having that journal. It really comes in handy. Right. So in the back of our brochure, we actually have a diary now. So with your first 8 purchases, you're able to actually write down what worked for you or what did not work for you. So for instance, myself, I used to suffer from anxiety. I do from time to time now. So at Trulieve and other dispensaries, they have a strain called Sour Diesel. And I cannot do Sour Diesel. Sour Diesel will have my heart racing and I can't function. It feels like I've taken 10 caffeine pills. Right. Other strains in that realm I can take, but that strain just doesn't work for me.
And this is a perfect example of you listening to your body. Your body will tell you what works and what doesn't work. I know that, again, people are always looking for the take 2 pills and call me in the morning effect. Cannabis really isn't that way. As you try a one-to-one product, which is 1 CBD, 1 THC, start with 5 milliliters, go up to 10, use it for a day or two, then go up to 10, use it for a day or two, then go up to 15. At some point, you'll feel a little bit euphoric effect. That's when you know what your THC tolerance is, and you can back down from there. Again, I recommend keeping just some pure CBD around when you're doing that. So if you do get a euphoric effect you don't like, you can take some of that. It'll actually mitigate that right away. I know there was one question about where to buy pure CBD products, because I think you as Trulieve don't necessarily sell CBD products by themselves. But I work with a group and I have a website called My Botanical Wellness. And Lee, can you put that in the chat and we'll use it in the follow-up information. We have doctors that have looked at CBD products, looked at which CBD products are the right ones to use that we know are effective. They all have certificates of authentication, and we make that website available to you at mybotanicalwellness.com, and you can be able to pick up CBD products from there to be able to package and sell. So you know you're getting a quality product that's there. I still recommend that you take a serious look, and I think the marijuana-based products are going to add the THC that you're going to need, especially for pain. So I'm not recommending that. The reason I didn't include it in this is because CBD by itself isn't going to help with pain. It'll help with inflammation, which will reduce the pain. But we're looking for something that can address the pain, which is where you're going to need some CBD or some THC, excuse me, to be able to really get that job done.
And it looks like there was a question from, did you answer Shreen's question? Like she was saying, is sativa good for PTSD and anxiety? I won't mind answering that question for you.
Go ahead,
quick. So I would say yes and no. First answer would be no. It depends on which sativa. For if you have anxiety, I would say stay away from sativas completely. Try a ratio product or a indica.
Or a hybrid
A
product
hybrid. Yes.
that's indica leaning.
Yes, correct. Because if you have anxiety, a sativa can actually, like I was saying before when we were going to that slide, it can give you a racy feeling. So like the sour diesel, that's one good example. So me and sour diesel, it will give me a panic attack. Not saying it'll give you a panic attack, but um, when I took it, knowing that I had anxiety, um, it was just too much for me, and my body said, "No, you cannot have this." So, to answer your question, like Mark said, try a hybrid or a ratio product or a hybrid indica leaning hybrid. One of
Right.
those may work for you.
Right. Yeah, I would be very, very careful, especially with PTS. I'd be very careful about using pinene, for example. That's one thing I'd probably shy away from. And I would typically stick to the indica leaning products themselves. It doesn't mean that you don't have a little bit of sativa in there if it's a hybrid, but make sure it says indica leaning, which means it has more indica in it than sativa. It'll probably help you quite a bit. I know with anxiety, clearly an indica leaning product is something that's going to help you quite a bit.
Definitely.
Yeah, I would, and your body will tell you what works. I have good conversations with Alex about using CBD gets him high like THC, which I found very interesting, and it happens in a few people. Again, listen to your body. Your body will tell you it's there. And again, go low and go slow. As you're getting into using cannabis, use a little bit. Use the 1-to-1 ratios. Start with 5 milliliters, then go to 10, then go to 15, then go to 20, and you'll find where your ratio is, and then you can adjust from there. You can put in more CBD, or you can put in less THC. I know that when I had my knee operation, I was using higher levels of THC to address the pain, but as a healing process came in, I found out that by being able to use higher levels of CBD to THC, it reduced the inflammation, which reduced the pain and helped to promote the healing. And so a lot of my regimes today, I did mention I use a 4-to-1 in the morning for the pain, but after that, I'm very heavily leaning towards CBD products, and I very much in the evenings use the indica products quite a bit.
Nice. And see, when I was going through my situation with my foot, I actually used, like I was saying, RSO. I had indica RSO, and instead of taking, like you said, the medication that the doctor gave you, it made me feel a little bit weird also, and I had to stop taking that, and I actually went directly to RSO only, and was actually taking, I've been a patient for a while, so I was taking a little bit higher dose, but it was going straight for the pain, so I wasn't getting that euphoric feeling, but it was hitting the pain where I needed to hit, and I was shocked. I'm like, I literally took 3 doses of RSO, and it'll normally knock me out, but it went straight to my foot and basically healed the pain, because my foot was definitely swollen from compound metatarsal fracture, and I had pins in my toes. But thank God, like I said, the RSO and cannabis actually worked for me.
Right. And there are RSOs that you put out right now that have higher levels of indica in it and higher levels of CBD in it than before. I know initially RSOs were very high in THC, but I think they're coming out with different varieties now that have. Again, I have an RSO that's very high in CBD, which I find very effective.
Correct. And then at Trulieve, we also have sativa, indica, and hybrid. Sativa being our newest one that came out maybe about a year ago, but each one of those has its own unique benefits to them. So, yep.
We one of the questions that came up, Anonymous asked one of the questions about any particular recommendations for indica heavy or leaning strains for pain. Do you want to address that one, or you want me to take that one?
I'll let you take that one, because there's a slew of things in my mind.
Well,
I'll let you take that one.
I'm going to answer it this way. We went over in the chart a number of the indica leaning, a number of the what I call CBD dominant strains for pain, and a lot of those CBD dominant pains are indica leaning. My recommendation is, over a web conference like this, it's hard because the way, and again, we're on dosing, every person's body is different, and I can't say take 2 pills and see me in the morning. My recommendation is call Trulieve, get a consultation. have them be able to access, if you are a medical cannabis patient, they can access your dosing recommendation from your doctor. If you're not, don't worry about it. You can have a conversation with them, and they can give you they can help you with some very specific strains and products that'll be able to help you. And they'll be able to go more in depth than we can here in this discussion to address your particular issue. I think that's the best way to address that particular question.
Agreed.
Because you want to avoid the euphoria, but you definitely want to be able to address the pain.
Correct. So that it would be a touchy subject. So
well, it's a personalized subject, not touchy as much as personalized.
Yep, true, very true.
And what's interesting is, how do you get it personalized? Well, a one-on-one consultation is going to be the best way to do that. And I'm not trying to avoid the question. I'm trying to give you a path to be able to get that question answered effectively for you.
Right.
It's out there. So what's the bottom line? The bottom line on this whole thing is, you're in control basically when you're in the pain situation with the products that you use, and with cannabis, you're in control of what to use and how to use it. You're not going to get addicted to it, as opposed to opioids, which you are not in control. You're in control here. You're not going to get addicted. You can't overdose from it. You may get high, but you're not going to die from it. And that's what's important. And more importantly, you'll find that most people that I know that start taking cannabis end up having an entourage effect. They end up saying, look, I'm using it for A and it helped me with B. So you'll find that those are the bottom lines that you see with a lot of things that are out there that'll help you quite a bit. Anyway, Charlene asked a question, by the way. Let's run into some questions now. Can you get a consultation if you don't have a medical marijuana card?
Yes, you can. You just need to go to our website underneath virtual consultations. Let me pull my side up on the screen again. It may be one of these QR codes. I believe I put it on the side on the FAQ. Actually, you can't see my hand. I'm sorry. So on the FAQ, on this top QR code, if you scan it with your phone, you'll be able to go to our frequently asked questions page, and then be able to find that section. But on our website, if you go underneath find a dispensary that's close to your location. So say, for instance, you're in Boynton Beach, find the Boynton Beach location. Underneath that location, you're going to see a 1-800 number, of course, the address, but you're also going to see a schedule a virtual consultation section. Just click on that link. It's going to tell you about the virtual consultation, but also at the bottom down there, it's going to say reserve now, and you're going to be able to reserve either a 30-minute spot with a consultant that can run over. It's not stuck to that 30 minutes, but we do like to keep it in 30 minutes to an hour, but at the same time, you're not stuck within that time frame.
And I think this is where you're getting into an area that it would really be good for you to get some one-on-one pain. I know that two questions that come up and asking about one question that came up. Mary asked the question of, what about osteopathic pain? Is cannabis good for that? Do you want to take that one, Randy, or you want me to take it?
I'm gonna let you take that one.
Okay. The answer to your question is yes, it's very good for osteopathic pain. A lot of osteopathic pain comes from inflammation, not to mention the pain itself, which you saw in the Sanjay Gupta video about how the THC helps with pain management. But also, if you can also complement that with something where you're actually helping with the inflammation as well, it helps quite a bit. So your doctor will be able to, your medical cannabis doctor will be able to give you some guidance on that if you have a medical marijuana card. If you're not, again, use this consultation with the dispensaries. Because what they'll do is they'll be able to walk you through which products will be most effective, which terpenes in the products will be most effective for that. And that also goes for, Anonymous asked a question about nerve pain. It's the same thing. The answer is yes. If you take a look at my particular condition, which is herniated discs, that is flatly nerve pain. And it's something that I need both inflammation help as well as pain control to be able to address. It's out there. Listen, 7 herniated discs is no picnic, I can tell you, but I'm able to live a pretty normal life, and I've been able to do a lot of things that I never thought I could do before, and it's helped me basically get my life back, which is the objective of this webinar, to help a lot of people that are out there. We'll take one last question. Judith asked a question: have you ever used a CO2 pack, PAC? I have not. Have you, Randy?
No, I have not. PAC?
Judith has a question. The CO2 pack. I've not used one, so I can't comment on it, and I'm not very familiar with it. I'll be blunt. Judith, if this is something that's you need to get questions, send me an email to event@marijuanaaware.com, and I'll dig down on that one and get you some answers if you'd like. But I'm not familiar with it, so I can't really give you a lot of answers about that one. It's out there. Let's before we finish a lot of the other questions, why don't we talk a little bit about Trulieve for a second, because some of these questions really can be answered by the various products and methods that you use. I start this out by saying I put this picture up because a lot of people, when they look about cannabis, they're thinking about head shops. You're thinking about the Bob Marley kind of places that you go into. I found that these Trulieve, especially, most of the dispensaries are more like Apple stores than they are like, it's more like going into a Chico's than it is than going into a head shop. And this is an example of what a couple of typical Trulieve stores look like, right, Randy?
Yep, definitely is. So when you walk into our store, depending on if you do delivery or pickup, we accept walk-in. So say, for instance, you're a walk-in today. You come to our store, give your patient ID or your driver's license, which is another government ID that is used at the dispensary to pull you up. But just give your ID to the front desk attendant, and then they'll take you back once it's your turn, and then you'll be back here inside of what we call the showroom, and then you'll have your own personal patient consultant to be able to help you out and figure out what products works for you best.
Right.
That is basically the front of our stores.
Right. Well, then we talked about that. We talked about the nanotechnologies. We talked about transdermal technologies. This is really what you're talking about here, the nanomedicines, right?
Correct. So with the nano products, I like to think of nano as teeny tiny beads that are water soluble. So you can actually add this to your drinks or add this to your food and be able to utilize it that way. But you can also put it underneath your tongue. And with nano products, the bioavailability is at 90% absorption rate. So the patient can actually take less medicine with a quicker onset time. We actually carry nano products in our nano true gels, which is our edibles, which I'm sorry, I was speaking about that before. And then we also have our true nano tinctures. So it's going to be an 8-to-1 and then a 1-to-8 CBD to THC. With our true nano gels, they're going to be 10 milligrams for 10 pieces. Like I said, you can actually cut those pieces in halves or in fourths, and then basically take one piece, and then see how you feel from there, and then go on up and titrate your way up, or find your dosing from there. That starts at $55 for the tincture and then $25 for the actual true gels themselves. But
they work very effectively. Again, true gels are edible, so you be careful.
Yep, definitely. If you're using, I just want to say one thing about nano. If you're using, say, for instance, a normal tincture that is, I don't know, olive oil based or something of that nature, and you're taking 10 drops or something like that, if you're going to use a nano product, take 1 to 2 drops and stop right there and see how you feel. Maybe 1 drop or something of that nature. Speak with your doctor about that as well. But at the same time, you will need a lot less product in order to achieve the goal that you're looking for.
That's true. That makes a big difference. Now, ratioed products are important because here, for example, once I started with the 1-to-1s, once I found my THC level, I found that sometimes by increasing the amount of CBD, what I was able to do is be able to bring down inflammation, which brought down the pain. And so you have a number of products that are out there. So tell me about that. You have 1-to-1s for in the vapes, like 1-to-1s, 5-to-3s. Yeah, there's our famous Laughing Buddha, right?
Oh yeah, that's our famous Laughing Buddha. So we have our True Clear, our True Pods, our vape carts, our True Gels, which are edibles, and our capsules. These are all ratio products, so they're going to have a little bit of CBD and THC in there, or they're going to have CBN and then CBD within there, or CBN and THC, depending on the product that you purchase. But we're probably not going to touch on this tonight, but CBN is another cannabinoid that comes from the cannabis plant, and we actually have those in capsules. It's actually wonderful for patients. It gives you a non-psychoactive effect. But getting back to ratios, though, starting with True Clear, that's going to be one of our concentrates.
That's this little thing that's right here, this little syringe thing right here.
Yep. So that's going to be
a lot. So you just need a rice-sized drop of that.
Teeny tiny bit goes a long way.
Yeah, put it on a cracker, put it on some chocolate, doing something like that is the best way of using it.
Definitely is. Like we always said, start low and go slow. You can always add, but if you take too much, you can always uh, bring yourself back down. But you just definitely, I would say, don't want that feeling, but you'll be fine at the same time. That's why you want to possibly start with the ratio product, because it doesn't put you in the full realm of a sativa or indica or a hybrid, and being too strong or too potent for you. It kind of gives you that clear-headedness. So say, for instance, like Delta 8, as we spoke of earlier, which Marc is going to be having a webinar here pretty soon about.
And next week.
But, oh, nice. I was quick. But Delta 8 is kind of like I say, the little sister of Delta 9. So Delta 9 is going to be what we know as THC, but Delta 9 is just the scientific term for it and the actual term for it. But we have that in the 1-to-1 in our True Clear, and then we have our True Pods, which are on the right hand side. That actually says Delta 8 with the blue top.
Right here.
That's gonna be
right here.
Yep. Correct. With the blue top.
And that fits into this True Stick.
Yep. So it fits in the True Stick. We actually just actually, let me tell you a little bit about True Stick. So the True Stick is actually a medical delivery device, and it has a lifetime warranty, but the True Stick actually helps you dose. So whenever you throw that pod in there, it's already going to be filled with the product that you chose from. You're going to turn the actual True Stick on. I wish I had mine around me, which I don't, but you're going to turn the True Stick on, and then basically there is haptic feedback now. So when you take a puff off of your True Stick, it's going to have buzz after 3 seconds, letting you know, hey, you took kind of a dose, stop. Also, it has 3 different temperature settings now, as well as a lifetime warranty on the actual True Stick itself. So say, for instance, 10 years down the road, you drop, break it, something like that, it's a medical device, let us know what happened to the actual True Stick. We'll take it back, questions asked, but no questions asked, and be able to swap it out for something that does work for you, so that you're able to utilize your medication.
Sure.
Going over vape carts, also, our vape carts are going to be the natural 510 thread vape carts, meaning the bottom of it's going to be the normal screw-on battery vape cart, but we have that in a 1-to-1 ratio, a 5-to-3 ratio, and a 1-to-8 ratio. These
now,
are
the first number is CBD, and the second number is THC.
Correct.
So 1-to-1 means 1 CBD, 1 THC. 5-to-3 means 5 CBD to 3 THC, right?
Correct. So God's gift, as I was speaking about earlier, is going to be that 1-to-1 ratio, which is phenomenal. I couldn't say enough good things about that particular product, but
I think it's not just a 1-to-1 ratio. I think you also put some pretty good, you have a good terpene profile of that product as well.
Correct. Like we said, a little goes a long ways, but it's not that hard of hitting, and it eases you in. But as we always say, like I said again, I'm very cautious when it comes to concentrates with patients.
Right.
Please start like with a little bit. Listen to what we're saying.
Right.
Just don't go with the full Monty. Don't go full head first. Start with a teeny tiny drop and just see how you feel.
Yeah, the one thing you don't want to do is jump into grabbing 151 Bacardi on your first time out. That's for sure.
That is 100% for sure.
Go low and go slow, man. Learn from that.
Yep.
Now your True Gels are great because these are very soft gels, and I know I really like the fact that the only complaint I'll have, and I'll tell you, is these things sell out so quickly they're hard to find.
They are. That's that.
I mean, they're very popular.
That's due to we are one of the largest medical cannabis. We are the largest medical cannabis company in the state of Florida, with over 500,000 patients in the registry now. So we're trying to cater to everyone. So we do apologize for not always having particular True Gels, but it is noted, and we are still rolling them out. We actually besides the True Gels, I'm gonna jump over a different edible. We actually came out with a new chocolate. So we have a strawberry cheesecake chocolate. So
really,
but the True Gels will eventually make his way back around. But for the time being, actually we had a sale the other day on edibles. So
Right.
patients are able to get one free edible if they spend $100 or more, which is very easy to get to.
Right.
But yeah, but yeah, CBN also is another good product.
Sorry, I went ahead. Sorry about that.
Oh, you're fine. You're fine. But yeah, I'm just touching on CBN, but yeah, go ahead.
So tell me about your discounts.
Sure. So, like I said before, we have a return and exchange policy. I'd like to touch on that first because this is a trial and error type program. And you may purchase something that doesn't work for you. You don't have to be ashamed about bringing it back or anything of that nature. Just like I said, let us know why it didn't work for you so we can help you figure out something that does work for you.
Right.
We actually have a new discount program now as well. So we actually are running a promotion for this discount program. So if you refer a friend for this month, and it was actually going on last month as well, but if you refer a friend to Trulieve, you will get 50% off, as well as the new patient will get 50% off. So if you've never shot the Trulieve before for your first time, you're going to get 50% off. And then your second time, you're going to get 15% off. And then when you renew your card with the state each and every year, we're going to give you that $75 that you spent to get your card back in medication. Besides that, we offer a number of different discounts. We have a loyalty program, which means each point that you spend at Trulieve, each dollar you spend at Trulieve will equal 1 point, equaling 10% for 500 points. We have an EBT discount or a SNAP discount for patients that are needing that as well. We have a bulk RSO discount if you purchase 10. We'll take $100 off there. A wonderful veterans discount, a battery bundle discount, senior Sundays we have. So we give 10% out on Sundays to any patient over the age of 55. And then we also have a 25% off birthday discount as well. This is one of, actually, on my side over here, you actually see this QR code here.
Yeah.
So
what I recommend people do, I know the QR codes are cool, but go to Trulieve and sign up for your text message notifications. You send them out every day or two, but there's some great deals. If you're looking for discounts, you guys run some great sales, and the best way of finding out about them is through the text messages that come out.
Agreed. So we recently had a 40% off sale and a slew of different sales, but it's called a True Buds program. If you go to our website and type in True Buds underneath the search, or if you scroll down, it should be at the bottom, and you'll be able to sign up. Just type your phone number in there. You'll receive a text message, and then basically any sale or discount that we have going on at the time, you'll be the first people. One of the first people to know by getting a text message to your phone for the dispensary in your area. So
now I'm gonna leave leverage off of your senior Sundays and mention one of the things I love about your delivery program. And I'm a senior citizen is if you're over 65, it's free deliveries, right? Of course, your deliveries are only $15 anyway for any place in the state of Florida, but still you can save that. If you're a senior, you can order and have it delivered, which is great.
Definitely is. And whenever COVID happened, we actually took that price down because we knew people were hurting and knew that they were going to need their medication, and not everybody was still working or had jobs or different scenarios for everybody, So we had to figure out a way to mitigate that for the patients. So like you said, any patient that's 65 or older, is free delivery, or any patient that spends over $200 is going to be free delivery also.
Sure.
What I would recommend doing is going to our website and registering and creating an account. The best way to get your product the quickest, I would say, is either placing your order online by going to our website or calling it in. We do accept walk-ins, but the quickest way, as it says on the bottom, I should say pro tip, opt for express check-in to avoid lobby waits.
I mean, what that is for example, sometimes when I go out, I was mentioning I take a martial arts class, I pass by a Trulieve dispensary. So I'll place an order, and literally when I leave the house, I'll hit the express check-in, stop, literally walk in, pick up my product and keep on going. It's great. You don't have to stand in line or anything like that, which is phenomenal.
Yep. So right when you put your order in, you're going to get a text message from us. It's going to take you to what's called the Waitley app. It's going to show you all the not all the patients. It's going to show you a list of first names that are in front of you and basically show you where you're at in line and ask you, hey, are you 5 minutes away from the dispensary? Hey, okay, please check yes. Since you're 5 minutes away from the dispensary, we're gonna go ahead and put you in line. So you're not even at the dispensary yet. So once you get there, you're able to walk in, get your product, and walk out.
Yeah, you guys have done a great job on the delivery part.
Thank you.
Listen, we're going to wrap a lot of this up, but I want to take on some of these questions because we got some good questions that are still here, Randy.
Okay.
First one, Doris has been waiting a long time. Doris says, I suffer from chronic migraines, 3 to 4 a week from headaches due to a bad car accident. She also has fibromyalgia. Nothing prescription works. Can cannabis help? Do you want to address that one, Randy?
Sure. Let me read a little bit more. She says, how do you know what to use and how much of it to use it with that? Nothing I have been prescribed.
From a regular doctor has worked.
Yeah, so that's gonna, once again, I will offer, like Marc said, I will offer a consultation and have you go in and sit down and speak with somebody.
The answer is migraines. They just came out with a study about 3 weeks ago. It was released by the Israelis about migraines and medical cannabis, about how effective it is, and it was very effective. We did a migraine webinar a couple quarters ago, and we may do another one next quarter. It is very effective now, and it's been proven to be effective from a science point of view. The question is, what works for you? Because it's a matter of and it makes it personalized. I would recommend doing a consultation, because when you ask the question of how much that you need to help, they'll be able to walk you through a lot of that, and they'll also be able to help you walk you through a lot of the dosing that'll help you figure out to really find that sweet spot. To find your sweet spot usually takes a week or two. It's not something that you'll do. Sometimes it's a day or two, but I would say leave yourself about a week or two, and you'll be able to find your sweet spot, and you'll be able to get that nailed down. But I'd lean towards a consultation, because what that'll do is that'll address the products that have the terpenes, the strains for your particular situation, and they'll be able to actually walk through a whole dosing program that can really address this. And I can just say this will be a lot more effective than working with your regular doctor. If migraines are your issue, and as long as there's not some other underlying condition, it is very effective for migraines.
Agreed.
It's out there. One of the other questions, I think it's a good one, is I have heard that a ratio of 5 to 1 means 5 CBD to 1 THC is about what it takes for CBD to cancel out the euphoric effect of THC. Is that accurate? If not, can you make a recommendation that would allow a person to be able to function on a daily basis? You want to take that, Randy, or want me to take it?
I'll take part of that, because it really depends on your body, once again, but I'm gonna let you take the rest of it.
Okay, well, it does. Look, the answer is yes. A high concentration of CBD to THC will cancel out the THC effects. Now, in my particular case, 5 to 1 would probably be a good ratio to use because of the way my body works. But I know that in the case, for example, of my wife, she uses like 12 to 1s and 20 to 1s to be able to get the relief she needs without getting high. And again, that just has to do with her metabolism versus my metabolism. So it's something that, again, the answer is you're on the right path. Having that higher number up front is good. Try a 5 to 1. You might want to try a 9 to 1 or a 10 to 1 or an 8 to 1. I know Trulieve has a great 8 to 1 product, and see how that works. It probably will be the direction that you want to go. And again, use that consultation. Anytime you can get people to help you, find that sweet spot, take advantage of them.
Definitely. And whenever you do the consultation virtually, we go over like 50 different slides with you. So we go over the process with you. We go over what cannabinoids. We go over it really in depth with you, so that you have a solid understanding once you're finished after the consultation in general, and have the knowledge that you need in order to purchase the products that work for you.
Yeah, the answer is you're on the right path. The CBD to the ratio is right. We'll cancel it out. The question is what works for your body, and try it. I know my mother's ratio is 20 to 1, just to give you an idea. Now, she's a 93-year-old woman who's lived the last almost 4.5 years with cancer, or she's in cancer remission due to using RSO oil and CBD. But she has a higher CBD to THC ratio, which is good for her. One of the other questions that came up was from are these names the same at all dispensaries? And I think the way to answer that, and I'm going to let you comment a bit of that. The strain names, the types of strains, when you talk about the Kushes and you talk about that type of thing, all those names are all the same. But when you talk about specific delivery products like the True Stick, that's not the same between dispensaries. Is that correct?
Correct. So some companies have different names for different products, but we are a strain-based company. So you've heard names like Granite Purple, or like I was saying before, Sour Diesel, Headbang, different things like that of that nature. We're gonna have strains like that. So to answer your question, I would say no for mostly all dispensaries, but yes for us. We're gonna have strain names. So.
Yeah, if you're talking about the strains, you're talking about the terpenes, for example. The terpenes will be the same with all the dispensaries. Strains will be the same with all the dispensaries. The ratios will be interesting. I mean, almost all dispensaries have some sort of a ratioed product, 1-2 or 1-to-1, 5-to-1, 3-to-1, whatever. They all have something that's out there, and so all those will be the same. Now, the names of the products are going to be very, very different. And I do know that there are, for example, you have Trulieve has a unique product called the True Stick, and that's available only at Trulieve. I know there are other products, for example, like PAX, that is available at a number of different dispensaries. So, and the PAX cartridges are different. Do you guys have PAX cartridges?
No, we actually don't.
Yeah.
We do have the PAX 3, like I was saying before, just that's for the flower. We just actually
Right.
incorporated that just now with our harvest integration, but yeah, we do not carry any other packs.
But I think so the answer to your question is it's more if you're thinking about devices or actual product names, the products themselves, they might differ. But if you look at the actual, what's the components of them, whether the strains, the terpenes, and that type of thing, that is the same between all the different dispensaries.
Correct.
So I hope that answers that question. So Will has asked, is it possible to receive more than one complimentary consultation?
Yes, they're absolutely free. So, like I said, you can either do it online, and once you go to our website, underneath like where I directed you to, underneath find a location, you'll see a number, actually a list of times. So, you could pick 2 different 30-minute sessions in the same day. Say, for instance, if you're only able to be there at 30 minutes at 9 a.m. or something of that nature.
I have a friend of mine who went to a consultation, and then afterwards it got more questions than he had answers. About a
that
day
happens.
later, and not at the time, but a day later, he had more questions than answers. So I said, call and get another consultation, and they do.
Yeah, it's free, and it's a lot of good, helpful information. I actually did the first one for the company, and actually it was a 2-for-1, and I helped both patients out. I answered all the questions, and I'm not gonna say who the people were, but they were older and they had more knowledge. They were so happy once we got off the phone, and I answered every single question they had, and they threw a couple curveballs at me, but at the same time, I was able to accurately come back with a rebuttal and answer for them.
They're just testing you, Randy. That's all.
I know they were.
The last question I'm going to take on before we sign off is Anna asked the question. She says, I'm originally from Michigan, and I'm looking for a brand, Good News Counting Sheep and a Tree Town Mango Recover. I love the names of those products.
I like those too.
I've never heard of them. And Anna, I'm sorry, I don't know where to find them. I've never heard of them. That's and excuse me, I'm here in Florida. I've not heard. Have you heard of them, Randy?
I have not. I was going to say the same thing. I'm sorry, I have not heard of those, unfortunately. It may be a Michigan product. You may have to go to that particular company and just
let's find out. I love the names of the products, and they probably are very effective. You know, it's just I've just not heard of them here in Florida. That's all. And I don't want to be a bearer of bad news, but want to answer your questions. So, let's see, hold on here. So Alita asked a question, is there a good strain for IBS, irritable bowel syndrome? Do you want to take that one, Randy?
Sure. So there's a couple different strains, and it would come down to terpenes. So I'm gonna let you take the terpene part, but I know Super Lemon Haze, which is sativa, is wonderful for that. That's going to be depending, I'm not depending, but due to this terpene profile. But there are a number of other strains. But these are specific conditions. But I'm gonna let you take this one as well, Mark.
On the top of my head, I haven't got a list of this there, but the answer is yes. There are very good strains for IBS, and in fact, we did a webinar on this about two quarters ago. My counsel tip, Alita, the best thing to do is get that consultation from Trulieve, because if you bring this up, they'll tell you exactly which products will help you. And I haven't got that in front of me, so I don't want to waste your time and give you some bad information.
Yeah, it would be hard to go off the top of our head right now, but like I said, I know for other people, like Super Lemon Hazes help. Like I said, because of the terpene profile, but definitely, I know we're pushing and speaking about virtual consultation or consultations in general, but they are very important. And if you get that one-on-one with somebody at the store itself, you will be able to pinpoint what works and why it works, and then have a more in-depth outcome.
Sure. Well, listen, Randy, we've gone an hour and 45 minutes.
Wow.
We've covered a lot of ground. We've covered a lot of terpenes. We've answered a number of questions. First of all, I want to thank everybody for joining us tonight. Without you, these wouldn't be available. These wouldn't be effective. And again, our goal is if we can help just one person get their life back, we can help one person improve their life condition, then I think we've been successful with this webinar. And so hopefully that's you. Please feel free to send us any questions that you might have through the events at events at both of the emails work, event and events at marijuanaware.com. We want to thank you for being here. I will mention, I'm going to throw a shameless plug in for the Delta 8 webinar that's going to be put on next week. But I also want to thank you, Randy. Get any final comments? And thank you very much for your help tonight. It was very helpful.
Oh, you're very welcome. And my final comments would be please sign up for a virtual consultation. Stop by your local Trulieve at any point in time. And yeah, we're more than happy to help you.
Yeah, I think you guys have done a great job. And Randy, you did a great job answering some of the questions. We're not trying, again, because this is something that's very personalized, we're trying to get you as much personalized service as we possibly can. So please consult your medical marijuana doctor, consult your consultation that's out there. If you're an MMTC, medical marijuana treatment clinics, a Florida patient, they have a dosing center, which can help you also as well. So, and that's free. So please feel free to take advantage of that. So there's a number of different support systems that are out there. A lot of people don't know about it, and that's why we're bringing it up. But Randy, thank you very much, and thank Trulieve for sponsoring this. Lee and Deja are commentators in the background. Good job as always. Without you, we would be sunk. It's something you helped quite a bit, and I'm going to give a special shout out to Alyssa, who came up with the idea of this webinar series, and is really the person who is the spark plug to make it all happen. I want to thank her very much. But thank you all for joining us tonight. We really appreciate it. Randy, thank you, and I hope everybody has a safe weekend. And we look forward to seeing you next week for the Delta 8 webinar. Thank you.
Thank you all. Have a great night.
Bye now.